Welcome back to TV5 News at 9, everyone. It is time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have Dr. Minyu Malhotra from the Covenant Cancer Care Center. Thank you so much. How are you this morning?
Good morning, Blake. I'm well, thank you.
Yes, thanks for coming in. We're talking about a big breakthrough in cancer treatment. And let's start with one of the biggest breakthroughs of the decade. That's what you said about immunotherapy. Can you just tell us what it is? I don't know anything about it, and how that compares to chemotherapy.
Absolutely. So immunotherapy ramps up the immune system of the body to attack the cancer. So we are basically taking away the brakes from the immune system such that it can attack the cancer cells. The advantage is it's easier on the body. There's not as many side effects, but more importantly, the immune system has a memory. Analogy would be vaccinations. So the responses are more durable. You know, if, for instance, if somebody's getting diagnosed with a stage 4 non-small cell lung cancer, in this day and age, we expect about 20% of the people to be alive and disease-free in 5 years. That's not something I could have said 5 years ago.
Right. You mentioned one type of cancer. What other types of cancers would this work best for?
Yeah, so we started using immunotherapy over 10 years ago. And it first started out with metastatic melanoma. That was, you know, a universally fatal diagnosis, and that's where we started using it first. But now we are using it for all disease types, for kidney cancers, non-small cell lung cancer, a subtype of breast cancers, and esophageal, gastric, so quite a few.
Man, okay, that's a great, you know, the more the better that we can cover. So another breakthrough is genomic sequencing. Can you tell us a little bit about what that is and when a patient is tested?
Yeah, so genomic sequencing refers to the sequencing of the DNA of the cancer cells or the tumor cells. The goal is to detect an alteration or a mutation in the DNA that we believe to be the driver for that cancer, and then try to treat the disease by targeting that specific mutation. We recommend genomic sequencing for just about anybody with a stage 4 diagnosis. And if we can detect a target, the treatments for those targets are more effective, more tolerable, and have lead to a much better survival.
Okay, and I think what is really great here, the common message is that it's not as harsh of treatment as previous treatments, right?
That is correct. So chemotherapy, unfortunately, is associated with a lot more side effects. Immunotherapy and targeted therapies are a lot better tolerated.
Very good. So I know the team at the Cancer Care Center often stresses the importance of screenings and cancer screenings. Why is it so important to have that?
Well, obviously, if we can detect the cancer in the early stages, then we are more likely to be able to cure it. A cancer, when diagnosed in a stage 1, is likely to be cured in over 80% of the cases, as opposed to a stage 3 or 4. So definitely screening is the best thing we can do. Catch it early, cure it.
Absolutely, and I think that's a great message. What keeps your team so motivated, or what keeps you motivated to care for our patients in our community?
Yeah, it's the challenge, the hope, the belief, right?
Yeah.
The challenge that the disease throws at us, the hope that we will conquer it, cure it for as many people as we can, and the belief that we are making a meaningful difference in our patients' lives.
I thank you so much for the work that you do at the Cancer Center. So thanks for coming in.
Absolutely, thank you.
Yeah, absolutely. And if you want more information, of course, you could just head to our website and go to the hot links section. That's at WNEM.com.